Oftentimes we hear about facial feminization, but one concept that isn't as prevalent as it should be is the concept of entire body feminization. Doing entire body feminization is what I try to do when my patients are seeking gender-affirming care. Just like when I do facial feminization, I think of the face as a unit that I treat together to create harmony. The body needs to be thought of in the same way. Body feminization is a procedure where we are changing the shape and contours of the body from male assigned at birth to female, an identity that the patient is. So how do you do that? Body feminization involves doing liposuction. When most people do liposuction, they remove fat with a big tube and a hose. That's not how you do body feminization. For body feminization, what I do is I use ultrasonic liposuction to disrupt the fat. Then I use special tubes that move back and forth called power-assisted lipo to remove the fat. Once the fat is removed, and when I'm doing it for gender-affirming surgery, you have to take out more than assist surgery. Why? When doing gender-affirming surgery, to get the ideal result, after doing it for so many years, what I see and what I understand is you have to push it beyond what you would do in a cis person. If you don't, you will not get the result. So once I've done ultrasonic lipo, remove the fat with a power-assisted system, then I inject heat underneath the skin and use helium and plasma to shrink the skin. That fat is harvested. My goal is to make the back curve, make the stomach as flat as I can, bring the waist in and get rid of the love handles. That fat is then injected into the hips and buttock to create a shape. Sometimes people call this a Brazilian butt lift. That's not what we're doing. I am feminizing the contours. I am creating femininity in the shape of that person. Body feminization also includes breast augmentation. Now, if the patient has a significant amount of fat, I can do it with that. Otherwise, I'll do an augmentation. For me, body feminization is doing complete body liposuction, body fat transposition, and doing an augmentation. That augmentation can be done with different implants. There's saline, there's silicone, there's gummy bear. I have a discussion with the patient and we understand, what are your goals? What do you want to accomplish for the shape? What is your ideal proportions? And what are ones that are classically identified as female assigned at birth? We take that understanding, make congruency out of it, and create a shape. Body feminization for me is doing an augmentation, full body lipo, and fat transposition.